the past 2 years, Vietnamese orphan Son Pham has been living with Olwyn and Alan Walter and their 2 daughters in Halifax, Canada.
Oh, this is confusing. I'm trying to make one of those cowboy things, but it's not working.
Son's extraordinary in many ways. But on the left side of his face, Son's veins form a random network. They dead end. They're extremely swollen with blood, distorting the left side of his face. According to Son's already undergone 19 treatments. They've reduced the jumble of bloated veins by 50%. The goal is 80%.
You got a good one? Good.
It's usually 2 times bigger and it's kind of like that.
Good morning.
Good morning.
How are
Good
you?
to see you again, yeah.
Good to see you. How's everything? Good.
The injection procedure is called sclerotherapy, and it will be performed by Dr. Ahmad Alomari.
Sclerotherapy is basically injecting the abnormal blood vessels with an agent or a sclerosing agent that will destroy these vessels from inside.
As we discussed, the parts that we're going to address today will be these soft parts over here.
Very good.
And another one over there. And a couple of those around the eye and in the scalp over here.
Very good. The medications we use are quite toxic, and we'll try to avoid the adjacent tissue as we're injecting toxic materials.
1, 2, 3. What about a little smile?
Today's treatment will be more physically traumatic than usual. For the first time, Dr. Alomari will inject the toxic agent into sensitive tissues inside Son's mouth.
Perfect. I will leave my initials in your face as I do all the time.
One has to be careful not to inject the medicine inadvertently into a normal nerve, because that will destroy these nerves.
Then we'll see you after the procedure.
As Son is wheeled into the OR, he's scared, but stoic as always.
He's a very brave child, very cooperative, and I've never seen him actually complaining.
Dr. Ahmad Alomari is going to shrink a portion of Son's jumbled and bloated veins with a toxic chemical. A week from now, they'll be surgically removed.
This is patient Son Pham. He has a large venous malformation of the left cheek.
Son will have 2 more sclerotherapies before he goes back to Vietnam. So far, the treatments have done wonders for his face, thanks in part to the precision instruments.
The whole thing is
We do these interventions through tiny, small needles, so you wouldn't see any incisions on the skin or scars, and we'll try to avoid the adjacent tissue.
perfect.
But sclerotherapy comes with some risks. The malformed blood vessels are destroyed by injecting them with a toxic agent. The same technique is performed on varicose veins, but with a milder toxin than the one used today, ethanol.
15, 11. Let's start with 5 vials, and I'll take a 20 cc syringe, please.
Sure.
If the ethanol is accidentally injected into nearby nerves, it will destroy them. To help the doctor hit just the malformed veins, the toxin is mixed with a contrast agent. This enables Dr. Alomari to see the targeted veins in a live X-ray image.
You have to confirm the location and kind of get a good map of the anatomy. After obtaining the access and you confirm that you are within the malformation, you have also to watch for the adjacent tissue.
For the upper eyelid, we'll need a sharp, short needle.
Dr. Alomari has to carefully monitor the amount of ethanol he injects. Too much of it in Son's small body could trigger cardiac arrest.
He didn't feel it that bad, so I assume that I can give him a little bit more.
Suddenly, Son's heart starts racing. He can feel the toxin.
His heart rate is going up.
You see his heart rate going up despite the fact that he was getting anesthetics to control his pain, which means that his body is responding to the injection and he's still sensing some pain.
Son is given more anesthetic to deaden the pain.
His heart rate went to around 100. It's coming back. We'll do one inside the mouth.
With things back under control, Dr. Alomari prepares for today's most difficult injection, deep inside Son's mouth, in the sensitive tissue near his tonsils.
Just pass me the needle when I'm ready.
If Dr. Alomari hits the wrong spot, he could permanently damage the nerves in Son's throat.
So, ready?
Yeah.
Go ahead. Turn it on at 0.7 liter. Perfect.
The procedure is a success.
He did well. I'm expecting a lot of swelling for almost a week.
Besides his face, Son will also get swelling in his throat.
Good morning.
Hi, Son.
The next morning, Dr. Alomari checks up on Son.
Did you feel any pain when you swallowed the liquid, the fluid, the juice you got last night? Did you have any pain?
Does it hurt, son, when you swallow? Yes.
It does?
Yeah.
Okay, yeah.
The swelling in Son's throat is extreme. For the next few days, he'll have to stick to liquids with crushed pain pills mixed in. But there are no other complications.
And it looks healthy.
Good.
He just has to continue with the oral antibiotics and
Yes.
keep his head up and take his pain medications if he thinks he needs it.
Okay.
The swelling can stay for up to 2 weeks or more, and there's nothing to do about it at this point except waiting for the swelling to subside.
Usually, I had to drink over this side, but now I can drink straight like usually people should.
In the 2 years since his medical treatments began, Son has gone through an amazing transformation. Doctors hope that after the next 3 procedures, 80% of his venous malformation will be removed. Son will then go back to Vietnam to live with his foster family.